Okay, for this module's laboratory clinical pearl, I want to go over ominous markers you will see sometimes on routine blood work. Now remember that when patients walk in the healthcare system, one of the things that's guaranteed to happen throughout their journey of trying to figure out what's happening with their chronic condition is they're going to get lots of different lab work. So even if you don't run a lot of routine lab work in your office, patients are going to walk in with stacks of them. So you really want to make sure you look at them. Now, if you're not doing routine blood work in your office, you're really missing out on a major tool that can really help you. And one of the first steps you should always do as a functional medicine practitioner working with chronic patients is make sure they don't need to be anywhere else. Make sure there's no underlying pathology or any kind of red flags before you get into any kind of interventional treatment program. So I have this chart that I made here. It's called Ominous Biomarker Patterns. And there's a few markers that I want to discuss with you that would give you a clue that there's something ominous happening. When something ominous happens, we mean that they could have underlying malignancy, they could be seriously ill, and some type of diagnosis needs to be further evaluated. They may need to walk into the conventional healthcare system and get appropriately managed before you start doing a lot of functional medicine, dietary lifestyle strategies, not knowing when it was actually happening. And remember that a lot of people have given up on conventional healthcare because they feel like they don't want to go get an annual physical exam and see their physician because they don't want to go on any drugs, they don't want to go on medications, or they just feel like working with their alternative healthcare practitioner is all they really need to do. And a lot of times, routine pathological evaluations that we picked up on something like a blood test may not be done. And other times you just have people walk in the healthcare system, but the physicians they're working with are really so focused on end-stage disease, and little changes of some of these markers doesn't really mean anything to them, and they can simply ignore them and just move on from there. And that does happen as well. So there will be times you will be faced with these ominous patterns. And ominous patterns means you have 3 or more of the following: cholesterol, a sudden drop below 140, albumin below 4.0, globulin above 4.5, lymphocytes below 20, absolute lymphocytes below 15, platelets below 150 or above 450. Now, another way to say this is just use your laboratory range. If it's below the laboratory range, that's what we're looking for. We're not really looking at functional levels here. But if all of a sudden you see sudden drops of a marker, especially cholesterol, that would be one of the red flags. So let's talk about that first. And one marker by itself isn't that clinically significant, but if you see 3 or more, you're starting to wonder, is this patient really ill? Is there some type of underlying oxidative stress, significant inflammatory, significant tissue breakdown pattern, malignancy, something of that nature that's happening with them? So let's start with this one here, cholesterol, a sudden drop below 140. So one of the things you have to understand is when people get really sick or people get tumors, when people have severe inflammatory responses, especially acute responses, and have these huge drive of acute phase reactants where things like ferritin or C-reactive protein can go up, and sometimes there's severe inflammation, but CRP is still normal and ferritin is still normal. But when there's different types of immunokines released, they have an impact on cholesterol synthesis. Now, when you're looking at cholesterol, so if someone normally had a cholesterol of 205, and all of a sudden it's 110, that would be considered an ominous marker. Now, if someone had cholesterol 205 and it went down to 110 in the past, 2 weeks, 3 weeks, that's definitely an ominous marker. Okay, if someone had a cholesterol 205 and 2 years later they were down, it's not as significant. So the closer one test is to another, the more acute the patterns are, the more of a concern you have. Okay. So you have to be aware that also, are there any medications that they've been taking? Is there anything that could have influenced those markers? So the scenario you're really worried about is someone comes in, they have their cholesterol levels measured in January, it's 205, and then in February, for whatever reason, they get it checked again, and now it's 90. Now it's 110. That is a red flag. That is definitely an indication some inflammatory oxidative stress pattern is going on. So the closer the lab tests are to each other, and the more significant the levels are, then it should be a red flag. Now, if someone goes from 205 to like 180 in a month, that's not that big of a deal. So usually you'll see the levels drop below 140. It'll be much lower. The greater the drop from their baseline, and the closer one test was used in comparison to another test, the time frame the shorter those time frames, the more concerned you are for a sudden drop in cholesterol. The levels of cholesterol not really dropping below 140, but dropping 20 to 30 points over the past year, 9 months is not that big of a deal. Okay, so that's one of them. So you'll see here cholesterol synthesis. The other thing you'll see here is when these immunokines are upregulated in these ominous types of clinical patterns, sometimes you do get some bone marrow suppression of platelets, and you'll see a drop in platelets. This will be below the laboratory reference range. And once again, you might see their platelets were fine a month ago, and now they're really low. So a sudden drop of these markers would be another red flag. So if you really look at all these mechanisms are related to an acute immunokine, significant immune response that's very severe that can change these parameters. Okay, so you'll see that as another marker there. Albumin synthesized in the liver. Sometimes these immunokines impact the liver synthesis of albumin. And albumin is the most abundant protein in our bloodstream. It helps modulate our osmotic pressure. And if you start to see albumin levels below the lab range, even though this is below 4.0, just assume your laboratory range, not a specific functional range. So if albumin levels are below the lab range, that's another potential ominous marker. And then you may see changes in total lymphocytes. If the total lymphocytes totally drop, if the absolute lymphocytes totally drop, and sometimes, even though it's not on this chart, you can just see a huge spike of them. But typically you'll see the depletion, you'll see these things levels drop. Those are indications of these immunokines being involved in just driving the immune system very aggressively. And the other key thing you may even want to consider that's not on this chart is when you look at white blood cells, like the white blood cell range is typically 4 to 10. And usually with most healthy people, it's somewhere between 5 to 6. You start to see white blood cells in the 9 range, 9.5 range, 10. Looks like they have an acute immune infection or inflammatory response. That's always a red flag as well. Now, globulin is involved with making immunoglobulins and hemoglobin, and many times if there's something that's significant, like a malignancy, the body will start to make antibodies and immunoglobulins against that. So you'll see globulin levels, total globulin levels go up. And then platelets, we talked about this separately in a previous clinical pearl. We talked about elevated platelets, and elevated platelets has a very strong association with risk for metastasis. So again, any of these markers but that are showing this pattern, especially if you start to be suspicious, you start to be concerned when you see 3 or more. So when you see 3 or more, that's when you're like, okay, there's something happening here. I need to figure out why. Now, I will tell you, in a conventional healthcare system, they're not going to look at this and go, oh, the ominous pattern is showing up. We need to do further testing. That absolutely does not happen. That'd be pretty much be like, your cholesterol dropped. That's great for you. Globulin, cholesterol's up. It's okay. They change every now and then. So that does happen. So you'll be sometimes in a situation where you see 3 or more of these and you're a little bit concerned. And then, what's the next test you want to do? So let's talk about some things you can do. The biggest concern is obviously to rule out any type. You can look at to rule out any other types of disease or pathologies. Therefore, you definitely want to look at the rest of the panel, see what's happening. Sometimes when people have like hepatitis C and their chronic hepatitis C gets reactivated and has been checked for a while, you'll see these ominous patterns. So it's not malignancy. Other times, someone has cancer that wasn't diagnosed and they have metastasis now, and they've been working on their chronic fatigue syndrome for the past 2 years in alternative medicine circles and never really had routine blood work or had this identified, and it's pretty serious. So it varies, but the biggest concern is to first of all look at any other patterns you see on the blood work, and then start doing some testing, especially for cancer and malignancy, and see if anything is involved with that. And then where do you start? Well, in the Cross Institute Longevity and Wellness course, we talked about looking at serum biopsies or liquid biopsies or blood testing. And, I think one of the early detection DNA fragment tests would be something to definitely run. So the GRAIL multicenter cancer test is one I would definitely consider when you start to see these ominous markers. and it's just a blood test. And what they'll do is they'll check for DNA fragments, and there's been some good research that's now showing that these are very reliable as a general screening test to look for cancers, look for the cancer signal, and this is going to probably be the future of early detection. The biggest issue with this test is that it's not cheap. It's $1,000. It's not really covered by insurance for most healthcare policies. But if you're willing to go there as a patient, and you're concerned about how you feel, and also not functioning well, it may be a test to definitely consider. So this GRAIL test, looking at these mitochondrial DNA signals, will check for all different types of cancers. If you go to their website, you can learn more about them. But it's really what's considered a liquid biopsy to look and screen for various cancers. The DNA fragment GRAIL test will check these major types of cancer. So they'll basically, when you get the results back, they'll say no cancer signal detected, or they will see if there's a cancer signal detected. If a cancer signal is detected, then they will also tell you the most likely tissue, and then we'll call you up and say, hey, we got this result back. There's a cancer signal detected from your patient, and we think it's the ovary. Let me make sure you're aware of all the current guidelines for testing that should be done when there's ovarian cancer that's suspected. So this is a screening test. You still have to go through conventional diagnostic workups, but now at least you know which tissue to look at. So if you saw ominous markers and really weren't sure where there could be some type of cancer cell, the DNA fragment, this multi-cancer GRAIL test can be a really good way to find that. So that's one thing to definitely consider. Another thing I think will be more widely used based on research that's coming out is to consider also a whole body MRI. Now, full body CT scans are definitely not something you want to do. It's way, way, way too much radiation. But when you look at whole body MRI, this is something that can be very useful just to see if there's any growth or any abnormal tissues or anything that's involved. And there have been several studies that looked at whole body MRI. This is one of them. It was titled Whole Body MRI Imaging Techniques, Guidelines, and Key Applications, Cancer and Medical Sciences. The journal was published in 2021. And they go on to say that whole body magnetic resonance imaging, WBMRI, is an imaging method without ionizing radiation that can provide whole body coverage with a core protocol of essential imaging contrast in less than 40 minutes. It can be complemented with sequences to evaluate specific body regions as needed. In many cases, whole body MRI surpasses bone scintigraphy, computed tomography, basically the CT scans, in detecting and characterizing lesions, evaluating the response to therapy, and a screening of high-risk patients. Consequently, international guidelines now recommend the use of whole body MRI in the management of patients with multiple myeloma, prostate cancer, melanoma, and individuals with certain cancer predisposition syndromes. The use of whole body MRI is also growing for metastatic breast cancer, ovarian cancer, and lymphoma, as well as for cancer screening amongst the general population. In light of that increasing interest from clinicians and patients in whole body MRI as a radiation-free technique for guiding the management of cancer and for cancer screening. Now, whole body MRIs can vary in cost. They can be anywhere between $1,800 to $2,500. So again, it's an expense for the patient, and typically, it's not going to be part of an accepted and approved plan, treatment or testing for most healthcare insurance policies. The patients will typically pay cash, but this is another way to really screen. And even in the Cross Institute Wellness Longevity course, we talked about, hey, if you haven't had one done, once you hit a certain age, it might be a good idea just to get a screen and see where you're at, and maybe repeat it, a few years down the road, and 3 to 5 years down the road, and see where you are. This was a review paper that was published in Cancer Imaging on whole body MRI for cancer screening in asymptomatic patients. And what they found is, in this study, they looked at 12 studies. They looked at 2,104 whole body MRI examinations with asymptomatic patients with no symptoms. And then with these 6,000 patients, they found 17,961 abnormal findings were reported. 91% were benign. And for the most part, most people that get a whole body MRI are usually, typically older, And they have some degree of neurodegeneration. And it's usually spinal neurodegeneration, or disc herniation, or some knee degeneration. So majority of people that get a whole body MRI will have something positive show up, but it's usually just, spine or joint degenerative changes. Then they go in and say that of the abnormal findings that were found, 9% were oncologically relevant, requiring further investigations, and 5% of subjects had no abnormal findings, while 95% had abnormal findings. Findings requiring further investigation report in 30% of all subjects, though in only 1.8% of cancer was suspected. The overall rate of histologic confirmed cancer was 1.1%. So, it's a good screen. And for people that had no symptoms, they did find some early cancer. So these are another thing to consider when you see ominous markers. So the key point with this is drop in platelets, a drop in cholesterol, drop in albumin, drop in total lymphocytes, drop in absolute lymphocytes, increasing globulin platelets, especially an acute change in these biomarkers. And these are all outside the laboratory reference range. If you see 3 or more of these ominous marker patterns, be concerned that there could be something going on. Look at the rest of your lab work, look to your clinical workup, a history, see if there's any concerns for anything. Obviously, if they had a history of past malignancy or cancer, you're always concerned that maybe their ovarian cancer now has metastasis, or prostate cancer that was being checked and monitored may have expressed itself further throughout other tissues and there's metastasis there. Or they could just have an early tumor or other things that may be involved. So the liquid biopsy with the Grail test is something to consider, and whole body MRI is something to consider. Those are going to be really good ways to screen all different tissues where you're not sure where things are coming from. Anyways, I hope that information was useful to you. Thank you for your attention.